Hi, and welcome to the show. Rate and review at kevinmd.com/rate. Subscribe at kevinmd.com/podcast. Today's show, we have Brian Gelbman. He is a pulmonary and critical care physician. His Kevin MD article is titled, "The Time is Ripe for Virtual Care Solutions in COPD." Brian, welcome to the show.
Thanks, Kevin. Thanks for having me on.
So we'll get into your article in a little bit. First off, briefly share your story and journey to where you are today.
All right, sure. So I'm a pulmonologist. I practice in New York City. I'm actually in private practice, but I'm on faculty at Weill Cornell. I would describe my practice as a general pulmonary practice, but I've always kept a hand in research. I try to collaborate with my full-time faculty on clinical research at Cornell when it can come. When I was a fellow, I did a lot of research in COPD on genetic studies. And then as I've been in practice, I've been sort of interested in emerging technologies that will kind of complement the care of COPD patients. So my first experience with that was with a portable spirometer. Someone was making an alternative to that. And we did some studies in COPD to make sure that it matched kind of the gold standard, which is our pulmonary function testing. And then that kind of evolved where I met a company called Wellings. They made a portable nebulizer and realized that that was kind of the first step towards this whole array of digital solutions that you could come up with for COPD patients to monitor their spirometry at home, monitor their nebulizer use at home, monitor their medication use at home. And so I had done a pilot study on that because Wellings had a platform for kind of collating all that information and following your patients. And after that study, I realized that, this had tremendous potential. And so I don't think there was a lot of knowledge in the general pulmonary community about it. And so that was the reason, that was sort of the impetus for the article to kind of broaden the awareness of, what's available now and what's probably where the future of this is going for COPD care.
All right. So before we get into some of the technological advancements when it comes to COPD, just from your practice, what are the biggest challenges COPD patients face today?
So, a lot of these patients, with the nature of this chronic illness is that they have limited mobility. A lot of them are homebound, and coming into the office for appointments is a challenge. And I was often struck by the fact that, geez, we make decisions on these patients, seeing them once or twice a year. And often by the time they show up in my office, they're very winded, their oxygen levels are low just from getting there. They don't look like themselves, and so it's hard to make adjustments based on these short 15-minute visits that you see once or twice a year, especially in a patient who's got very limited mobility like COPD patients have. And so that was one reason why also with this article, we have the tools to kind of better assess these patients in their home environment. It's a lot less taxing on them, and it's a lot more informative for the physician.
All right, so let's talk about that article. The time is ripe for virtual care solutions in COPD. Now, tell us, how did this article come together?
So the article, as I said, it came about as after this research project I had done with Wellings, where we took 20 patients of mine who had severe COPD, who were very limited in their mobility, and we wanted to see, could they adapt to a digital tool, something that was based on an app on their phone that would monitor their spirometry, it would monitor their pulse oximetry, it would monitor their medication use. And to our surprise, these patients did very well with this platform and were eager to see this kind of technology evolve. And so I just felt that, here I am, I'm practicing somewhere where we have a lot of resources in New York City. I realized that, geez, these, all these tools, which are being developed by many people, are easily scalable. They are something that could be deployed, irrespective of where people live. And so I thought, there hasn't been, it's in the early stages of all of this. And I thought it was a good time to sort of broaden physicians' awareness of what's available.
So take us into that workflow. So one of the patients who had this platform, they could do spirometries at home with the app. So walk us through that and how you would get that data, and tell us what you would do with that data.
Yeah. So I think a lot of these chronic disease management all start as monitoring platforms. And so the way this is all, I think the field's evolving, is that you've got these digital tools that can record vital signs, oxygen levels, spirometry, medication use, and it would collect it and would prevent in the way that it would present you with a 1-month summary
Hmm.
of all the data on the patient. And the idea would be that you could pick up changes on these patients as they kind of happen in real time. They're also set up to provide alerts if there's actually a drastic change that happens, say someone's oxygen levels are falling and sustaining. But in general, this would collect all the data and present you a monthly report. But what's also evolving with these tools now, it's not just a data collection with these digital health solutions, but it's also a way to augment patients' care. And one of the biggest ways I think that one of the biggest potentials with these tools is some things where there's very severe limitations, such as pulmonary rehabilitation, can be administered through an app or a digital platform like this. So not only is it receiving information, but now it has the ability to provide information to the patients as well.
So tell us the case study of a specific patient, or it could be a hypothetical patient, where you receive this monthly snapshot of their COPD status and how you made a medical decision based on that.
Yeah, so, one of my patients who really loved the system was very diligent about putting in all his information. And we could just see that his medication adherence was very good. We could see that his vital signs were stable, so that when he would come in for a follow-up visit, let's say, and said, my COPD seems much worse. We've already ruled out, medication compliance is one reason why there might have been a change in their health.
Mhm.
And start looking for other things like, say a virus that might have exacerbated their COPD, and then you can adjust their care plan accordingly.
And in general, like, are there a lot of different types of platforms like this? Like, how common is something like this?
Yeah, I think there's a lot of platforms in development. Not I of course am just focused in COPD. It's probably a little bit more advanced in some other chronic disease states. I know diabetes is far advanced in what they can offer in digital health solutions, between monitoring patients' glucose levels and then making suggestions about medication changes from that. I think the same is true of congestive heart failure, where they can monitor a lot of things about the patient and then also give feedback to the patient about how to either adjust medications or make lifestyle or diet modifications. I know a lot of companies are doing the same thing with COPD, which is where my interest is.
Yeah.
And I think there's a lot of potential there.
Now, in terms of costs, like let's say if someone were to implement, or primary care or pulmonologist wanted to kind of implement some type of remote monitoring system like this. So, what are some typical costs to the patient? Is it covered by insurance? Things like that.
That's an excellent question that even to this day, I'm not totally clear on the answer of, because it raises the question of who will have to pay for this at the end
Yeah.
of the day. I think most of the modeling I've seen does not expect the patient to pay for it. I think the field is evolving where they're trying to convince the payers to pay, the third party payers to pay for it. And I think we will get there. My understanding is a lot of the third party payers, of course, want to know that this is cost effective. And so a lot of the companies that are developing these platforms are trying to show that this is going to reduce hospitalization. This is going to reduce overall cost to the healthcare system by having a platform that can help monitor someone's chronic disease state. I have seen other models where they actually charge to the physician, and the physician can actually, there are reimbursement fees through Medicare for doing remote patient monitoring. To me, I'm not sure that model makes the most sense. I think ultimately what would have to happen is these platforms demonstrate that they are cost effective, and then you get the payers to basically pay for it in order to keep their costs down on these chronic disease states.
Now, one of the things with remote patient monitoring is kind of the inundation of data, right? So I'm sure you're very busy. I'm in primary care. I'm very busy. And, we have people with like Apple Watches just kind of automatically report back things like EKGs and all this data, right? So how do you sift through all that data, in terms of your busy schedule and separate that signal from the noise?
I don't think the workflows are in place right now. And I think you're right. Like it's going to be, um, it's going to be a little bit of a sea change in how we all, approach our patient care visits. Nothing like, to me, when a patient comes in with stacks of paper with their blood pressure readings for a month, it's kind of hard to flip through it and make sense of it. But I think these programs do have the ability to help us synthesize that information in a way that makes a lot of sense. I don't think anyone knows the ideal way to present, months or years of COPD data, for example. But I can tell you, I'm also a sleep physician. A good analogy is I do get these sleep reports for my sleep apnea patients, and they have a nice job of synthesizing, how often the patient's using the system, how much air leak is happening, what the average pressure settings are. And you get used to looking at these, summary reports that go on over months. And I could see a very similar, output from any of these chronic disease states, and where we as physicians will become much more accustomed to looking at this data quickly and realizing how to make changes from it.
So you have a general pulmonology practice. So how do you incorporate, these periodic COPD snapshots from that remote monitoring system into your daily workflow?
Well, I'm not there yet. No system is really mature enough yet to be there. But how I do envision it going ahead is just like you said. I could see, right now when I see a COPD patient once or twice a year in the office, I'm usually just relying on the vitals I get at that visit. I'm usually just relying on how they're feeling in in the last week or so. And so what I'd like to see it evolve to is when you see those patients in their semi-annual visits, you've now got 6 months of data synthesized in a way that you can understand with a summary sheet of that in front of you. And then you can make your adjustments based on that to medications, lifestyle.
So from a primary care standpoint and to those of primary care clinicians listening to you, so what's on the horizon when it comes to COPD treatment? It could be treatment, it could be technology. What do we have to look forward to?
Yeah, I think these digital tools will really facilitate the care of these patients without one necessarily even relying on seeing a specialist like myself. I think especially in less resource rich areas, it'd be wonderful for a primary care physician to refer a patient to these digital solutions where of course, it takes a lot of time to manage these patients. And I think these platforms, in addition to all the monitoring we've been discussing, they'll have the opportunity to give patients, help with medication use, how to, show them how to use their inhalers. They may be able to connect them with a pulmonary rehabilitation
Mm.
specialist and do pulmonary rehabilitation through the app, or even some health coaches to talk to them about tobacco cessation and healthy diet. So all the things we know we should do as physicians, and we don't have the time really to do on a 15-minute visit. I think there's now the digital tools in place to really help the care of these kinds of patients.
And how, from the patient standpoint, how easy was it for them to adopt these digital tools? Was it a pretty straightforward uptake?
It was. Yeah, that was really the most surprising thing from one of the most surprising things from the study that we did is that almost all I think all 20 patients in the study easily understood how to use the app, and they all rated it very high and wanted to see more of it.
And in terms of spirometry at home, what does that entail?
Yeah, so they had there's a lot of digital spirometers at home, and any of them, they're all Bluetooth, a lot of them are Bluetooth enabled. They can connect with many different apps. And so the patients were able, that was one way they could get an objective measure of how their lung function is. And one thing we showed in our study was that had correlation with the same readings we would get in the office.
We're talking to Brian Gelman. He's a pulmonary and critical care physician. His Kevin MD article is titled "The Time is Ripe for Virtual Care Solutions in COPD." Brian, tell us some of your take-home messages that you want to leave with the Kevin MD audience.
Well, I would say to everyone, I think these digital health solutions are definitely going to be the wave of the future, especially for a lot of chronic disease states. I think of them as an excellent complement to everything that we do. I don't view them anyway as a threat to the physician-patient relationship. There's so many small things we all know we need to address and deal with these patients. And frankly, our current models don't really provide the time to sit and speak to patients about, at depth about tobacco cessation, or maybe spend all the time we need to show them how to use their inhalers, or even, make sure they're using their medications
Mhm.
correctly. And so I think we've got a huge wave coming in front of us of tools that can really help provide all those missing pieces that are kind of slipping through the cracks right now, but really would make a big difference in patients' care.
Brian, thank you so much for sharing your time and insight, and thanks again for being on the show.
Kevin, thank you so much.